Hello, my name is Alexandra Lomini. I am an FMP student at Regis College. Being in the healthcare field is my calling. I enjoy making a difference in the lives of others. I am a BSN registered nurse currently working in emergency medicine in an urgent care setting. In this setting, I care for various population of patients. In terms of this topic, I also care for older adults who have suffered from falls. Falls within the elderly population is an issue that is occurring more often and has become a common issue resulting in more injuries. This can be due to gait and mobility disorder, vision impairment, vitamin D deficiency, postural hypotension, foot or ankle problems, or issues like environmental and home hazards. These are all modifiable risk factors that play a major role and put this population at high risk for falls. According to the Centers for Disease Control and Prevention, CDC, each year, 1 in 3 adults aged 65 and older experiences a fall. Falls are now the leading cause of injury-related deaths among this population and the most common cause of non-fatal injuries and hospital admissions for trauma. The purpose of this evidence-based practice grant proposal project is to learn, draw awareness, and discover the risks associated with falling in the elderly population, while also finding ways to reduce future falls by educating this population of patients on risk factors, positive lifestyle changes, and interventions to prevent the issue of falls from occurring often. Although it seems obvious that maximizing the impact of any interventions relies primarily on clinicians referring patients to existing community-based programs, little effort has made to bridge the communication gap between clinicians and community service providers. A lack of integrated fall prevention healthcare systems that link clinical referrals to evidence-based community interventions. The goal is to engage partnerships and relationships between clinicians, health insurers, and community service providers to fill gaps in converting evidence-based fall prevention interventions into practice while establishing a clinical community linkage system. The framework chosen for this clinical research of fall prevention is conceptual framework. This theoretical framework is relevant to this topic because it thoroughly breaks down all areas of the research topic to aid in preventing and resolving the issues of falls using the theoretical framework. The framework purposes 4 broad categories of fall prevention intervention system: pre-fall prevention, post-fall prevention, fall injury prevention, cross-fall prevention, and other categories include application type, technology deployment platform, information sources, deployment environment, user interface type, and collaborative function. For this study, the participants will be recruited by persuasive sampling, which is non-probability sampling that is geared towards a certain population of individuals within a study. The inclusion criteria will be 50 years or greater. The sample size will be about 10 participants within this population of people. Participants who are enrolled in this study will sign an informed consent that is approved by an institutional review board. This topic is significant in the nursing field because it is a growing issue that requires lots of attention, understanding, as well as education on both the side of the RN, the patient, and family members involved. It is important to have patients and their families involved in the treatment plan and be a part of the whole process from start to finish. There are prevention opportunities out there, such as strengthening programs and balance programs that can help the patient with their musculoskeletal integrity, such as the STEADY toolkit, Stopping Elderly Accidents, Deaths, and Injuries, developed by the CDC, which is a screening and evaluation algorithm that tracks interventions based on each individual's level of risk and the fall tips, tailoring treatments for patient safety toolkit, which helps in clinical decision-making and interventions to facilitate a personalized fall risk evaluation for each patient. My evidence-based proposal should be funded because this is a common serious issue that sadly is growing within this population. And providing the right tools, education, and having interventions in place can help reduce this issue from being an ongoing problem in older adults. Thank you all for your time, and I hope you consider my proposal for consideration to be funded. Thank you so much. God bless.